I don't know if we're gonna have anything to come back, but we'll at least do it just in case. Okay, public lands and facilities.
Morning.
Morning.
I have one item here, it's seasonal staff at the Turkey Creek Golf Course. We're gonna be losing 3 seasonal staff to going back to school, and staff would like to recommend the following 3: Courtney Brumley, Bailey Hollinger, and Parker Van Camp to fill those positions.
I'd like to make the motion to approve making conditional.
Study session.
Study session
Oh,
Yeah,
sorry.
yeah.
to bring
So
next week.
it's okay to bring it next week,
Okay,
okay? Is that okay with you?
that's fine, yeah.
Okay,
Yeah.
all right, thank you. Okay, Jeff Woodward, Public Works.
Okay, with the resignation of Don Bickford from the street department, we'd like to start the hiring process for an EO2, EO1, or equip operator in training. We currently have 1 open position and 2 that are on restricted duty.
And along with that, I'd like to start the hiring process, go back to commission meeting and start the hiring process for that position. Any problem with that?
I don't have a problem.
Okay.
Are you sure you, on the seasonal positions that we just did for public lands, do you want to start hire them if we go back, when we go back, or you wanna wait a week?
I think we're ready to go ahead and start.
Yeah, let's do it.
So, okay, yeah, that's why I asked the question. We'll do, when
Makes
we
2
come back
things
in,
then.
we'll do this, okay.
Okay.
Let's go on to 2-2 Elizabeth Street Community Sewer.
On June 22nd, the commission authorized the installation of new sewer main along Elizabeth Street to eliminate the Elizabeth Street community sewer. We expedited our normal process because residents, one residence on Elizabeth Street was without sewer service. The commission authorized a street crew to replace the sidewalk and driveways in-house. We put together an estimate in the amount of $5,517.99 to complete the work. And then, do we want to pay for that? I assume we want to pay for that out of wastewater.
Yeah.
Yes. Okay, bring it.
Okay. The next item, I was asked to bring back the Lakeside Drive estimates. We put these together 3 years ago. We don't really have any current comparables with the county work. The asphalt overlays, part of these are still accurate. West Lakeside, if we can get the county to help us out, we put an estimate together for $166,280 to put to an outside contractor, and with the super slurry base and overlay, we estimated that at about $415,000. East Lakeside Drive, Kansas Avenue to Maxwell, again, with the county's help, we could do that for around $183,000, and super slurry and overlay, hiring an outside contractor would be a little over $500,000.
So in this process, are we talking to the county then to see?
I've not yet.
But I'm just saying, will you?
I can.
Yeah.
Yeah.
And then the other piece is, where are we at, on finances?
I haven't looked at this, I still review it.
Were
Busy with COVID stuff.
were we talking about for next year? I mean, I know, Gary, you brought it up to me and you said you want us to explore it again, but are we talking about a project for next year? Are we talking about covering it with some of the mill and overlay that we designate for next year, or what are we talking about time frame wise? I know.
I would just like to get it done either this year or now. I'm not that particular about it, but I think it needs to be done because those roads are terrible out there.
They are in poor condition.
Yeah.
I don't believe it'd be possible. It'd be really difficult. I can check with the county, but they're having trouble getting, aggregates when we met on the Northview Trail, so I think it's probably next to impossible to get it done this year.
Okay.
So I was just looking for a little direction if we're doing it next year, wanna look into doing it next year.
I'd say let's look into the finance part of it.
Is this coming out of what fund? Street fund?
Consolidated Street?
I can tell you that this, if it's coming out of Fund 26, the street fund, we didn't have enough money to do the projects that were indicated on the ballot question. So, if we're talking, this is over $1 million to do all three of them, there's, I can tell you, the money's not there.
Let's
There's-
put some numbers together and figure out where
There's
it's.
two separate ones.
Yeah.
The other thing we could do, we could break it into however many pieces, you know, you desired to do.
So let's do that, and whether or not any of this comes out of the park fund.
I'm just very interested in that BOMAG procedure to see how that would work out, if we could get county to cooperate and help us out.
Okay, we did the BOMAG procedure, on Avenue A between the railroad tracks and, Maxwell. We had some real bad patch areas in there. So the process works real well, and then we overlaid it. We also BOMAG'd, South Front Street, towards the west end. That's a really low traffic, it only feeds 2 residents there. And I think we sealed it after we were done there. And it's held up okay, it's not great, but again, it's very low volume. So I think with the amount of traffic down there, it really does need, if we do it, we need to BOMAG and overlay it.
Okay.
Okay, well, let's talk about the finance part. You guys can be talking,
Either-
and then we can bring it back. And we'll talk about where we could do it, if we can't do it next year.
Okay, we're looking at which is our preference, east or west, and do we want to try to break it out into 4 separate sections, or?
Well, I think we're gonna have to. I don't, I'm looking at the finance part of this thing, and I think we need to break it up into 4 different pieces
I
to
think
start
the
with,
West
and
End-
maybe the first piece to be done maybe next spring, early next spring, next summer, see if we got financing for that. If we don't, well, then we'll push it off.
The part that's on the west side is gonna be the most critical, because that's the most traffic.
Right.
It's probably the worst shape of any of it.
Yeah, it is.
Anyway, let's see, let's take a look at this thing, and then we'll talk about where we go.
Go ahead.
I guess my question is the commission willing to put these projects above your normal mill and overlay of roads?
Not necessarily.
No, we just want to look at where we're at, how this could be done, and then once we know from you, if it can't be done, there's no sense of going to the county right away.
So just
Okay.
wait with going to the county for another week. Can you give us some numbers in a week?
Sure.
Okay?
And what, I didn't get that. Which fund do you want this out of? Are we taking it out of the street fund?
We're not sure where we're taking it out of. We wanna
Okay.
look at what are our possibilities,
Okay.
okay? If it means we have to not do some of our regular work next year, I'm hard pressed to make that
Sure.
kind of decision.
Okay. Next item, out of the wastewater treatment facility, the emergency electrical repairs. On May 24th, the break in the reuse piping system under the pump room flooded the biosolids building. Damage was done in the electrical in that building. Emergency repairs had to be made, and we received an invoice in the amount of $4,449.83 for that work.
So you bring it
I'd
this week?
say bring it next week.
Okay.
I think we're fortunate that it wasn't a lot more than that. Could have been 2 to 3 times that much.
Okay, Nick Gregory, Administration COVID-19 report.
The last week and a half, we spent a lot of time we met with the McPherson County 2 weeks, not not this last week, but the end of the week before. And we've met with them about their $5.7 million in CARES fund that they have to distribute throughout the county based upon what the allocation the state's given them. And we've been working quite diligently. I know Janetta's been worked exclusively on the reimbursement with the help of a number of people around the city to start putting those actual cost figures that we're going to request for reimbursement together. And so there was a kind of a two-part piece to what they wanted. There was phase one, which was asking for the reimbursement piece. That first reimbursement is basically everything from March 1st to July 31st. And so we kind of, the way we did is we, luckily, when this whole pandemic started, we did a really good job recording whether it's time worked by specific employees and also expenses tied with that. We set up specific accounts for each department for COVID-related expenses. So I won't say that it wasn't without a lot of work, but we were able to put together a reimbursement list and with a lot of work to try to get it in after we found out 2 weeks ago that the deadline was to get it in here by the end of the month. We went ahead and put a lot of that effort into that. And there is a report that is attached that shows a total reimbursement amount of time and expenses that we've had at $172,338. And I don't know if you want to talk a little bit about that before I get into the second piece, which is direct planning spend. So I'll let you kind of hit the high points of that and give us a summary of that.
Sure. I printed out a copy of what you have in front of you just for your own record. But as Nick indicated, there has been a substantial amount of work from all employees, not only those that are involved in the EOC, but those that are involved in just COVID activity. And so, in completing the reimbursement request, which was due into the county last Friday, the 31st, which I do want to add, since it was due the 31st, but it was supposed to cover expenses paid through the 31st, we have a strict cutoff of what was reported on here as far as salaries and wages, as well as items purchased. So the stipulation was that it had to be paid for to be included in this reimbursement request. So we know exactly where the cutoff was, and we then took where that cutoff was and used those numbers to estimate for the direct plan, which Nick will get into here in a minute. But this was the summary of what we're talking about for reimbursement. And if you look down at the very bottom, once again, the total that we're asking for is $172,338 even, which was kind of ironic that it was an even number for a change. But what's included in those totals are out to the right, which were payroll costs, overtime costs. We also calculated a benefit cost of 40% of salaries and wages. In that was an allowable cost that was indicated in the CARES Act. And then also any equipment or mileage costs that is affiliated with any sort of activity that was performed. And so the different categories and subcategories, those were automatically assigned by the Sparks committee as far as the breakdown of those of the activity. And so what is more relatable to what we're talking about is the actual activity column, which the first one for a total of $32,824.40 was any sort of cleaning or sanitizing or prepping city assets. So the majority of those costs were once again payroll and benefits with some usage of city assets to perform those activities. The next one at $33,127.56, that was basically EOC operations as far as administrative activities, meetings, attending webinars, those sorts of activities. The third one being training personnel at $3,188.19. This was really at the onset of COVID when we were out training staff on how to sanitize, how to clean, a lot of webinars on what was going to be covered in certain things. And so that has kind of diminished over time, but there was a lot. So we didn't include this training activity in our direct plan moving forward, as we figured that it wasn't a lot of training going on at this point in time. The next one is communication / news release to the public at $9,215.33. This is mainly salaries and benefits for those people that were included in the EOC, the Public Information Officer, and anybody that was on that team. They were busy with news releases, anything out on social media, updating the web page and the hub news. And that is also another activity that we included in the direct plan. The next one was transporting of test kits at $7,841.58. This is when the police and fire were actively transporting kits up to Topeka. We didn't include this in the direct plan. As I understand, they have contracted that out to another agency. The next one is overtime to cover quarantine personnel. This is at $4,666.12. And then we're starting to get down into some smaller numbers. Also the food drive, we had a lot of staff that was coordinating and working hard at the farm to families at $1,384.78. And then based off of the FMLA and quarantine pay, we've asked $25,579.64. And then the last item was the purchase of any sort of PPE or COVID materials and supplies. We spent a lot of money on disinfecting, wipes, PPE at $53,643.51 for a total of $172,338. And so as we indicated on Friday, I submitted the reimbursement detail in the format that the county and the state has required. Also provided the agreement, which apologize it wasn't in your packets, but the mayor signed it on Friday. It's up here, and it basically just states that we follow and agree to all of the stipulations that were made in the CARES Act, and also got them copies of every single invoice and receipt for the $53,643.51. And so that's all I've got for the reimbursement fees.
Are the decontamination in that 53,643?
The 42,000, the Aeroclave?
Yeah.
Yes,
Yeah,
it was.
okay, just being
Absolutely.
sure,
Yep.
okay.
Yeah, and we,
Okay, I would like to, when we go back into session, to be able to pull up that agreement and approve that agreement today.
oh, okay.
So we need to do that, so that we have a record in the minutes that we did approve that being sent out, and we should probably approve, at least accept the report of this CARES funding reimbursement when we come back into session.
Okay,
Yeah,
perfect,
all right,
perfect.
yeah.
And once again, I just wanna thank all the department heads and especially TJ for allowing Chris to help. She was definitely shining star when I needed it and was working from home, because I can tell you that municipalities are not staffed to handle this sort of pandemic. It's a lot of work, it's a lot of time, and I appreciate that very much. And we'll continue to keep on until this thing goes away.
Yeah,
Thank you.
yeah, I don't know if you have to leave there if you have input on, Great.
I'll stay up here. in
Yeah, why don't you
case-
stay up here, because I'm gonna kinda have you talk a little bit about
Okay.
parts of the second part that we worked on. The second part of the CARES Act is a direct spending plan, and this is what we are requesting. With the county, when they had this meeting, they laid out that these are for either for expenses to get us through the remainder of the year as it relates to PPE, labor, or special projects that we have for the upcoming, to get us, that all have to be spent, incurred, and completed by December 30th of 2020. And we put something out to our department heads to ask them if they had any specific projects to be included. But another piece of this was, as we talk about what we've done to this point, from a disinfectant, from a meeting standpoint, from an education standpoint. The first part of this you'll see has to do with we basically took what's been spent to this point on the pandemic, and we averaged it out to hopefully get us through the rest of the year. And so that's what, if you look at the first, probably the first 5 or 6 items on this list, if you open it up, you actually have it on your drive as well.
it's under
You
Plan
wanna-
Independent.
You want to hit kind of what we kind of estimated to get us through the rest of the year as far as that
Yeah.
goes?
What you have in front of you, this is the summary page, and behind this summary page is a lot of detail, and don't necessarily need to click on every single one of them, but as Nick indicated, the first few are basically a mirror of what I just spoke about. It is those activities that we are going to continue as a city to be involved in as it relates to this pandemic. And the first one being anticipated labor to man the EOC. So the $39,264.45 basically takes all of the labor and benefits as it relates to the reimbursement report and the amount of weeks that we had paid out, and then we just estimate that going forward from the time period that the direct plan covers, which is August 1st through December 30th of 2020. Now, once again, I have included this week, or last week, because last week was not included in the payroll based off of the timing to get the report in. So that is basically the same sort of activity as it relates to the EOC meetings, that sort of thing. I just want to point out under expenditure category, health is spelled wrong, and that's not my doing, that's a drop down. So the state of Kansas obviously
Not in good health.
didn't do spell check. So that just goes to show you that every day, the guidance that was given, the information that was provided changed nonstop. So
Yeah, there are probably about 5 or 6 iterations of this
Yeah.
spreadsheet, so
yeah, so
before they had it.
so hopefully all of this, and we did a good job trying to relate our activity back to the actual Federal CARES Act guidelines. Every single one of them, I was able to hit back to their definitions. So it'll be up to the Spark committee at the state that's going to review this for approval. The next one is the program for COVID-related cost as it relates to the cleaning, disinfecting, public assets, public facilities, That's at $58,569.37. And as the mayor mentioned, the Aeroclave decontamination system that we purchased was included in the reimbursement, but we have included some staff time, which is just an estimate to go out and decontaminate either public facilities or private facilities if it so warrants. So that's included in there. The next one, at $13,247.04, once again, this is emergency communication. This is the same EOC labor as it relates to our public information officer updating the website, social media, and all that through this direct plan time period. Anticipated overtime due to COVID, this is at $7,807.72. This is any sort of overtime or back pay, not back pay, but pay for people covering for someone that may be quarantined or out with COVID. Legal consulting for COVID, this legal action and policies, this is our estimate as far as support from the city attorney and for his services as it relates specifically to COVID. And then funds for potential quarantine and FMLA leave. This is estimated at $36,770.73. And once again, this is for those people that are out due to COVID or quarantine based on of going into an area.
And that's just based upon an average that we've already seen so
Right,
far.
right.
so-
These are all based off of our actuals that we have spent from the March 1st through into July, and then extrapolating those from August through the end of December. So there's a lot of things that could change between August and December, but we did our best guess of just assuming that the same practices will be followed. But
Farm
that
to
could be-
Family is the other one too
well, on
that's
the
on
farm
that
to
list.
families, yeah, I just heard that TJ said this will be the last week, so I assumed, for that last week in July that we didn't get covered, and then I assumed another 4 farm to families, so, I'm not exactly sure what it looks like as far as how this, if this is approved by the Spark, committee, how that's gonna be, how that money is gonna be
I
then
did talk with
distributed.
Rick on that, and he didn't know exactly how they'd handle it. He thought maybe on some of the funds that are like the regular operating type things, whether we'd request that portion on a monthly basis, and they'd provide some of the stuff
that's
that I
what
also want to get into, which I'll get into after Jeanette is done.
Yeah.
Just up front in a cash, in a cash distribution, so he
Yeah.
didn't know for sure
Well,
exactly
I
how
thought
they
I
wanted to
either
handle that.
watched in a webinar or read somewhere that they were going to request that we do a reimbursement report similar to what we just did on a monthly basis in order to bring that money back down to the city, so.
Yeah, but on the farm to family, we still correct that amount. This is going forward. It's
This
not
is
set
going-
in.
This is going forward, yes.
Yeah.
So.
So I wanted to hit on everything below that line are things that we are requesting to get us through the remainder of the year, and some of these are project related. These aren't necessarily estimates on labor. Most of the ones that Janetta went over are estimates on labor. The first one is fire PPE and disinfectant materials, and I kind of I sent that out. Did you have a chance to look at that, TJ? Just by any, basically, we listed all the PPE requests that the fire department had. I do need to change that change that to 115. So you've got basically the things like the coveralls, the gowns and stuff that we struggled to get in the past.
Correct, we went to washable gowns so we could reuse them over the period.
72 boxes of gloves, the 2,000 3M particulate respirators, N100 masks, safety glasses, face shields, some various critical basic medical supplies for treating COVID-19 patients, airway suction units, and then the PAPR devices that you guys approved last week. Because we haven't actually incurred that cost, we went ahead and added it to this list. And that gets us to $115,580.45 just for the PPE, and those are very critical PPE, so we're hoping
That's all the stuff that's nationwide being drawn down onto, so it's very difficult to get. And you have to buy it in a quantity that makes it worth their while to sell it. So they're looking for people, and they say, we have 6,000 masks, and they're at this price. And then you either get the opportunity to buy them, or they move on to the next customer.
and that'll be critical to get us through the end of the year and potentially beyond if this thing continues on beyond there. It gives us a stock at the end of the year that we can dip into. I think it's all pretty critical, and when you guys go out and respond, you've got to make sure you've got that PPE to protect both the public and your employees as well. The next piece is LifePak monitor defibrillators, and we've got these are basically the cost, the $69,004 is the cost of purchasing 2 of these units. And do you want to talk about what those do?
There's no way to read capnography right now currently, and also rhythms. So if we have any patients that, what we've seen with COVID patients is they're in, most of the time they're in major respiratory distress as well as cardiac distress. And we don't have the ability to see that. That's something that the LifePak monitor gives the guys the opportunity to treat more effectively by being able to realize and see what the capnography is, what their end tidal is, as well as their oxygen saturation. So that's pretty technical and medical jargon, but all in all, it helps them treat the patient better. It gives them the ability to identify what routes they need to give the proper medicine.
And where would those actually go? Those go in your rescue trucks?
No, that would go on the squad that goes out on the medicals.
And then the last piece is the CAT emergency response, and the total cost for that system is $39,131.96. You want to talk about that too?
CAD, we had an incident where we weren't given what they call it dispatch signal 19 is how we identify patients. We cannot see the live CAD updates in the fire department. Law enforcement has active CAD in their patrol cars, so they can see everything the dispatch is typing. And we can't see any patient dispositions or chief complaints or anything about the calls. So we're strictly relying on what's coming across the radio, or when these guys get on scene and they tell us this is what they're finding. Because of that, we've actually had people going into Signal 19 calls or COVID calls and not being aware that they were COVID calls. So this is something that will help us be able to get that live update of the chief complaint of the patient, as well as if it's a Signal 19 patient.
So that'll buy the CAD software, the
Tablet.
tablets that'll go in each of the vehicles, and the mounting system that goes along with that, as well as the booster antenna. So that's what that cost includes. The next piece, we've talked about, we've got Facebook, and we are doing it right now here. But as we talk about improving the quality and the ability for people to hear what's going on in the meetings, to see what's happening, to be able to switch back and forth from this screen to the camera shots and everything of that nature, to improve the sound in here, to improve our recording capabilities from a more permanent standpoint. The cost that we were able to get, and It did go up from when I originally sent that email out to you last week, but we're just under $40,000 to cover that, and you kind of see a list of everything that would include. But that would allow us to fully be able to have outside meetings, and if we wanted to bring in and also have our Zoom meetings, we'd have the best technology to be able to talk back and forth with folks that are on Zoom that want to, when we want to Zoom the meeting or anything of that nature, and this would be our primary room. We'd redo the antiquated system that's probably from the early 90s, 80s. So hopefully people that are listening to this meeting, for example, now will be able to hear and see better if we get funded for this particular piece. Law enforcement PPE, I got a list of PPE from law enforcement as well that they felt were needs to get us through the remainder of the year. The only add-on I'll say is that they asked for 2,000 basic surgical masks, and we asked for another 2,000 to cover the rest of city employees if we have needs at any of our places where we've got other employees. We added another 2,000 there. So we're asking for 4,000 basic surgical masks. We have bought some. That has got us to this point, but we've burned through quite a bit of that. There's 100 gowns, 70 P100 filters for their gas masks, 70 safety glasses, 50 boxes of gloves, 50 Tyvek suits, 100 face shields, 100 containers of Clorox wipes. They wipe down their cars and everything else on a regular basis, especially as they switch cars out. 10 60-ounce hand sanitizers, 100 biohazard bags is what makes up that $6,480. The other thing that the CARES Act does provide for is it gives us an ability, if we were to get an outbreak here, or if we were to have an outbreak in any of our departments, to buy a remote technology for us to be able to work from individuals to work from home, or if we end up having continue to have a push of additional cases, that we could cover that. What we've put in for is 19 notebook computers that would allow us to work. If half the office had to work from home right now, most of what we have is PCs. We do have some laptops, but far and few between compared to the full big PCs with monitors and everything of that nature. So we show putting in for 19 notebook computers like the one I've got right here, 3 rugged laptop computers for law enforcement, and 4 of those ProBooks are specifically for law enforcement as well. Antivirus program, 4 portable scanner printer modules so that individuals can work from home, get things printed off and back up here, and then 30 webcam microphones that can go on the PCs that we have here in the office, and the total cost for that's about $48,250. The next item is municipal court area expansion. Do you want to talk about that, Bo?
So currently at the municipal court, they're pretty much working on top of each other. There's no area to social distance or to get away because and I think the majority of all of you have been in there. It's just a small little cubicle area that they're in, both of them. And Ryan can probably attest on court mornings and stuff with everybody walking through there, there's no room. And so what we're looking at doing is taking the current area and then the bin inspection areas right next to it and just expanding it so that they actually have an office area to work. This allows them to social distance as well, and obviously with it being a 2-person office, it's critical that they stay healthy and that they're there working. We tried to telework where one was in 1 week, one was out,
Basically moving walls, electrical, maybe an HVAC vent or
Yeah.
something of that nature.
None of these walls are weight bearing, so it's just a matter of reconfiguring.
So I wanted you guys to be aware of what we're discussing on submitting and make sure that there's not any input you guys didn't want to have on the items that have been brought before us. You see that the amount being asked for is, you can see the subtotal up at the top on the first spreadsheet is $534,747.40 that we've got on for potential future items. I will tell you that the county, in our meeting with the county several weeks ago, they indicated that both the McPherson County Board is going to decide what they deem priorities, and they're also going to be submitting it to the state, and the state will determine whether any of these costs are eligible that they do send up there. So whatever we send, our plan would be, unless there's major changes, to go ahead and get that submitted this afternoon.
I would prefer not to send it this afternoon.
Okay.
We have a project that we're still working on. I would like a few days to see.
Okay, well, it's due Tuesday,
Due by tomorrow to the county.
so,
Okay? All right, we'll let you know by late this afternoon.
and Rick did say we could have, as long as we get it in by Tuesday,
Okay.
at sometime during the day, so.
Okay? We'll be able to submit it Tuesday.
So those are what we've kind of identified as staff as items to be submitted. And I don't know if anybody else has other ideas or anything else, any comments on the ones that we've listed?
All of these that are listed so far are either just extrapolating to the end of the year what we need, or some things that we've made due on that we didn't have the right equipment to get done. So it hopefully will get a kind review from the county to allow us to do this. And we have one more decontamination thing that we want to be able to talk today, and we will get back to you. But I don't see anything in here that we could say wouldn't help us with COVID-19.
Okay, maybe when you come back into session, that you authorize us to go ahead and submit this as well, as the reimbursement and the agreement, the memorandum of understanding, memorandum of agreement, is that what it's called? Yeah, the virus relief fund agreement.
Okay, any more on this? I gotta figure out how to get back out of it because my thing's stuck. There we go. Okay, is there anything else for study session? Okay,